Thank you for taking the time to view this video. The Providing Supportive Care in Outpatients project was undertaken as a NEMICS-funded scoping project. Project work was completed by myself, Bernadette Zappa, the Eastern Health Cancer Services Supportive Care Screening Project Officer, and Judy Allen, Eastern Health Cancer Services Occupational Therapist. The impetus for undertaking the scoping project was a decline in the supportive care screening participation rate at Eastern Health. Review of screening audit data highlighted particular patient cohorts and clinical settings being missed with existing screening protocols. The lack of screening in outpatient area was viewed with particular interest given the high numbers of newly diagnosed patients presenting in these settings. The lung outpatient clinic was chosen as a setting for the scoping project, as lung patients account for 10% of all new cancer diagnoses at Eastern Health, and also because of good clinician buy-in. It was no accident that the Director and Associate Director of Oncology at Eastern Health consult in this clinic. The aims of the project were to pilot an efficient model of supportive care screening in a lung outpatient clinic, to improve the understanding of the triage and referral needs of patients attending the clinic, to map and test supportive care and allied health referral pathways, and importantly, to generate data to inform the development of a lean, sustainable, and transferable model of supportive care screening.
For this project, an action research methodology was used, which means adapting and changing the methodology as we reviewed the outcomes of each clinic. Our sample for this project were patients with a diagnosis of lung cancer attending the outpatient lung clinic. In the beginning of the scoping project, we reviewed each medical file prior to the clinic and developed a risk matrix spreadsheet of patients we wished to provide a supportive care screen to. It quickly became evident that this was a very time and clinician intensive process. Over the period of the scoping project, we refined the interventions, with the final protocol being that the supportive care screen was given to the patient by the clinic reception staff prior to their medical appointment. Medical staff were then responsible for discussing the concerns identified on the supportive care screen with the patient. From this discussion, the patients were then offered an opportunity to further explore their concerns with an allied health clinician, or at the discretion of the medical staff, or when the distress score was over 8. 47 patients completed a supportive care screen over the 9 clinics. 16 of these patients, so 34%, were offered a total of 30 referrals to allied health or community support agencies. 59% of these offered referrals were accepted. The 5 most common concerns identified were fatigue in 25 out of 47 of the patients, breathing in 20 out of 47 of the patients, pain in 17 out of 47 patients, worry in 15 of the 47 patients, and then other concerns were sleep in 14 patients, memory 14 patients, skin 14, concerns with their skin 14 patients. Referrals included referrals to occupational therapy, dietetics, psychology or psychiatry, social work, the Oncology Rehabilitation Program, the Chinese Cancer Society, community rehab centres, and Eastern Palliative Care. Further findings and learnings included that the role of the allied health clinician impacted greatly on the referral and action outcomes compared with other screening areas. We believe that in this setting, it is the holistic approach of the occupational therapist that contributed to these outcomes. We noted that there was an increase in referrals offered, an increase in acceptance of referrals offered, and an increase in referrals to community-based services. For the purposes of this project, we intentionally focused on the problems identified on the supportive care screen and potential referral options, as opposed to only referring to immediately available referral options. Further findings and learnings from the scoping project included, given the high patient volume in the lung outpatient clinic, processes for screening needed to be simple. There is a significant administration and clinical EFT required in order to implement the most lean version of supportive care screening in an outpatient clinic. And finally, that there are significant gaps in the availability of timely allied health response in an outpatient setting.
The scoping exercise was fantastic in generating ideas and discussion around how to best implement supportive care screening in the outpatient clinic setting. Importantly, the discussions included the difficult issue of what would be considered an acceptable level of response to patients' identified needs in the context of a health service with limited access to dedicated oncology nurse care coordinators or allied health clinicians. We were fortunate that as these discussions were taking place, Western Health was engaging in a piece of research in which Cancer Council Victoria nurses were providing the first response to identified patient supportive care needs via the Cancer Council Victoria Information and Support Service. Clinicians at Western Health used a prescription pad to refer patients to the Cancer Council phone line. Use of the prescription pad had high clinician and patient acceptability and resulted in an 80% increase in calls to the Cancer Council from Western Health patients over the trial period. At Eastern Health, we are currently in the process of signing off on a prescription pad that has been tailored to the needs of Eastern Health. The prescription pad will be used in conjunction with the distress thermometer and problem checklist that is the tool used at Eastern Health for screening patients for their supportive care needs. Clinicians in the lung and uro-oncology clinics are excited about starting a trial with the prescription pads in May. And finally, some other grant applications learning. For a scoping project, it's important to ensure that the idea is consistent with the strategic directions of the clinical area you're working in to ensure senior staff support. Utilise the expertise of NEMIC staff and liaise with them about your idea. Start small. Be clear in communicating the expectations of the grant to key stakeholders. The staff in the clinic believe we are coming to stay, not just for a pilot project. And importantly, utilise the assistance from health service improvement teams and research departments if available.